Warning signs of colon cancer you should never ignore. Today, we have an important topic to discuss that could potentially save lives. We're diving deep into the warning signs of colon cancer that you should never, ever ignore. So, grab a cup of tea, sit back, and let's embark on this crucial journey together. Before we delve into the warning signs, let's take a moment to acknowledge the gravity of the situation. Did you know that colon cancer is the third most commonly diagnosed cancer in both men and women worldwide? It affects millions of people each year and sadly claims the lives of far too many. In fact, according to the World Health Organization, it is estimated that over 900,000 people die from colon cancer each year. This staggering number emphasizes the urgent need for awareness, early detection, and effective treatment options. Behind these statistics, there are real people, families, and communities impacted by this disease. That's why it's crucial for us to come together, educate ourselves, and empower one another with the knowledge to recognize the warning signs. By sharing this information, we hope to shed light on the importance of early detection, ultimately working towards reducing the burden of colon cancer and saving lives. So, let's equip ourselves with the knowledge needed to identify those warning signs that should never be ignored. Now that we understand the gravity of the situation, let's jump into the first warning sign: persistent and unexplained fatigue. We all experience fatigue from time to time, but when it lingers on without any apparent reason, it's time to pay attention. Persistent and unexplained fatigue can be a warning sign of underlying health issues, including colon cancer. If you find yourself feeling unusually tired, even after getting enough rest and sleep, it's important not to dismiss it as mere exhaustion. Colon cancer can cause fatigue due to the impact it has on the body's blood cells and nutrient absorption. Tumors in the colon can lead to chronic bleeding, resulting in iron deficiency anemia. This condition reduces the oxygen-carrying capacity of the blood, leading to feelings of extreme tiredness and weakness. If you're experiencing persistent fatigue that affects your daily life and doesn't improve with rest, it's crucial to consult your healthcare provider. They can assess your symptoms, run tests, and determine the underlying cause. Remember, early detection of colon cancer can greatly improve treatment outcomes, so don't hesitate to seek medical advice. Unexplained weight loss. Losing weight is often celebrated, but when the pounds drop off without any intentional changes to your diet or exercise routine, it's time to take notice. Unexplained weight loss can be a red flag for various health issues, including colon cancer. When cancer cells develop in the colon, they can interfere with the body's ability to absorb nutrients. As a result, you may experience unintended weight loss. If you find yourself shedding pounds without trying, and it's significant enough to be noticeable, it's essential to investigate further. We understand that weight loss can be a sensitive topic, but ignoring unexplained weight loss could mean missing a potential warning sign. It's vital to consult your doctor to rule out any serious underlying conditions. They can perform tests, including imaging and blood work, to help determine the cause and provide appropriate treatment if necessary. Persistent changes in bowel habits. The ever-important topic of bowel habits. Changes in how your digestive system operates can be indicative of an underlying health concern. If you notice persistent changes, it's essential not to overlook them. Pay attention if you experience prolonged periods of diarrhea or constipation that don't seem to resolve on their own. While these symptoms can be caused by various factors, they can also be warning signs of colon cancer. It's important to note that occasional bowel irregularities are common and often not a cause for concern. However, if you notice a significant change in your bowel habits that lasts for weeks or is accompanied by other warning signs we've discussed, it's essential to consult your healthcare provider. They can assess your symptoms, perform diagnostic tests, such as a colonoscopy, and provide you with the appropriate guidance and care. Remember, everyone's body is different, and it's crucial to be attuned to what's normal for you. If something feels off or unusual, don't hesitate to reach out to your healthcare professional for a thorough evaluation. Your health and peace of mind are worth it. Blood in the stool. Brace yourselves, because this warning sign is a critical one to pay attention to. If you ever notice blood in your stool, whether it's bright red or darker in color, it's time to take immediate action. The presence of blood in your stool can be an alarming symptom of colon cancer, or it could indicate other serious conditions such as hemorrhoids or gastrointestinal bleeding. However, it's essential not to brush it off as a minor issue, as early detection is crucial for effective treatment. When colon cancer develops, it can cause ulcers or tumors in the colon or rectum, leading to bleeding. This blood can mix with your stool, making it visible during bowel movements. It's important to note that the blood may not always be visible to the naked eye, so if you notice any changes in color or consistency, don't hesitate to seek medical attention. We understand that seeing blood in your stool can be distressing, but remember that not all cases of rectal bleeding are cancer-related. However, it's crucial to consult with a healthcare professional who can assess your symptoms, perform diagnostic tests like a colonoscopy, and provide you with an accurate diagnosis and appropriate treatment plan. Abdominal pain and cramping. Let's talk about something that many of us have experienced at some point: abdominal pain and cramping. While occasional discomfort is common, persistent or unexplained pain in your abdomen can be a warning sign that something isn't right. When it comes to colon cancer, abdominal pain and cramping can occur as the tumor grows and starts to affect the surrounding tissues. This can cause inflammation, obstruction, or pressure in the colon, leading to discomfort. It's important to note that abdominal pain can have various causes, ranging from gastrointestinal issues to muscle strain. However, if you're experiencing persistent or worsening pain that's accompanied by other warning signs we've discussed, it's crucial not to ignore it. If you find yourself dealing with ongoing abdominal pain or cramping, reach out to your healthcare provider. They can evaluate your symptoms, perform diagnostic tests, and determine the underlying cause. Remember, early detection and timely intervention can make a significant difference in your health outcomes. Anemia and iron deficiency. Fatigue and weakness are not the only concerns related to colon cancer. Anemia and iron deficiency can also be warning signs that shouldn't be overlooked. Colon cancer can lead to chronic bleeding in the digestive tract, which can result in iron deficiency anemia. As tumors grow, they may cause ulcers or erosion of blood vessels, leading to blood loss that often goes unnoticed. Over time, this hidden blood loss can lead to a decrease in red blood cells and iron levels. Anemia can manifest in symptoms such as extreme fatigue, weakness, shortness of breath, pale skin, and dizziness. If you're experiencing these symptoms, especially if they're persistent, it's crucial to discuss them with your healthcare provider. If your doctor suspects anemia or iron deficiency, they may recommend blood tests to measure your hemoglobin and iron levels. Based on the results, further investigations can be done to determine the cause, including colonoscopy to evaluate the possibility of colon cancer. Unexplained abdominal mass. Detecting a lump or mass in your abdomen can be an alarming discovery. If you notice a swelling or a hard mass that wasn't there before, it's crucial not to ignore it. While there can be various causes for abdominal masses, it's essential to consider the possibility of colon cancer. As colon cancer progresses, tumors can grow and develop in the colon or nearby organs, leading to the formation of an abdominal mass. The presence of an unexplained abdominal mass can be indicative of an advanced stage of colon cancer. It's important to note that not all abdominal masses are cancerous, as there can be other conditions like benign tumors or cysts. However, it's vital to consult with your healthcare provider to evaluate the mass and determine its nature through imaging tests such as CT scans or ultrasounds. If you discover an abdominal mass, remember not to panic. While it's important to take it seriously, only a thorough medical evaluation can provide an accurate diagnosis. Your healthcare provider will guide you through the necessary steps, which may include additional tests like biopsies or further imaging studies to determine the cause of the mass and provide appropriate treatment options. There you have it, dear viewers, 7 warning signs of colon cancer that you should never ignore. Remember, our bodies often communicate with us through symptoms, and being aware of these signs can help with early detection and successful treatment. If you notice any of these warning flags, don't hesitate and reach out to your doctor and get the care you deserve. Knowledge is power, my friends. Share this video with your loved ones to raise awareness about these important warning signs. Let's spread the word and encourage everyone to prioritize their health. If you enjoyed this video and want to see more content like this, don't forget to hit that subscribe button and ring the notification bell. We're dedicated to providing you with useful health tips and empowering knowledge. Thank you for tuning in today. We appreciate each and every one of you for being a part of our community. Remember to take care of yourselves and stay vigilant about your health. Thanks for watching and see you next time. If you enjoyed this video, watch this one next.